What if the specific way you experience depression could actually predict a specific future illness? Well, a really groundbreaking new study suggests exactly that. It's revealing a surprising link between your mood and your physical health that honestly goes way deeper than we ever thought.
You know, we tend to think of depression as something that just happens in our minds, right? But what if that's not the whole story? What if the way you feel depressed could be a clue, a signpost pointing to a specific physical illness down the road? Well, that's exactly what some new research is telling us.
Now, just to be clear, this idea that our mental and physical health are connected, that's not brand new. For years, scientists have seen that what happens in our minds has a really powerful effect on our bodies. So let's just do a quick recap of what we already know.
And the scale of this is, well, it's just staggering. The World Health Organization estimates that 332 million people worldwide are living with depression. To put that into perspective, the WHO thinks it could become the single leading cause of disability by 2030. So you can see why understanding its full impact is so critical.
The impact of depression really does ripple throughout the entire body. We've seen these clear links to things like a weakened immune system, chronic pain, and a higher risk for major conditions like heart disease, stroke, and even type 2 diabetes. But this established connection? It's really just the beginning of our story.
Okay, so this is where this new study gets really fascinating. Researchers decided to look past that single label of depression, and they asked a pretty radical question. What if different types of depressive symptoms could predict entirely different physical diseases?
And to do this, they used the idea of depression profiles. As one of the lead researchers put it, depression has many faces. So the study took these different faces and grouped them into two very distinct profiles, which we're about to see.
And here they are. So on the left, you've got what they call the atypical profile. That's the one with fatigue, sleeping more, and a bigger appetite. Then on the right, there's the melancholic profile, which is almost the complete opposite. Less appetite, weight loss, and feelings of guilt. So the huge question is, do these very different experiences actually matter for our physical health?
So what did the researchers actually find? Well, in this massive study, they followed over 5,700 adults for 7 years. At the very start, none of them had diabetes or heart disease. The scientists just tracked which depression profile they fit into, and then they waited to see what would happen. So, after 7 years, what did they discover? Did the specific type of depression actually predict a specific physical risk? The answer was a clear and pretty resounding yes.
First up, let's look at Profile 1. That's the atypical group. Remember, these are the folks experiencing symptoms like fatigue, increased appetite, and sleeping more than usual. So what happened to them?
The results were pretty stunning. People with these atypical symptoms were 2.7 times more likely to develop type 2 diabetes. But, and this is the really fascinating part, they showed no significant increase in their risk for heart disease. The risk was incredibly specific.
So what about the other group? For Profile 2, the melancholic group, those with decreased appetite and weight loss, well, the story was completely different.
And here's the mirror image. This group had a 1.5 times greater risk of developing cardiovascular disease. We're talking things like a heart attack or a stroke. But their risk for diabetes didn't go up at all. It's this amazing specificity that really makes this research a true game changer.
Okay, so this is incredible, right? But it brings up a huge question. Why? What is the hidden mechanism connecting these specific moods to these specific diseases?
I mean, the most obvious answers are lifestyle habits, right? Maybe people are less active, eating poorly, or smoking. And yeah, while those are definitely part of the picture, the researchers found they just don't fully explain this specific link. There's something deeper going on here, just beneath the surface.
And this gets to the core idea. One of the study's lead authors suggests that depression and these diseases might actually share the same biological roots, things like inflammation or big changes to our metabolism. In other words, it's not that depression is causing the heart disease, they might both just be symptoms of the same underlying problem.
So, where do we go from here? What does all this mean for the future of medicine? I mean, if different types of depression are really different biological conditions, it could completely revolutionize how we treat them.
As Dr. Christopher Palmer from Harvard Medical School puts it, this shows that depression isn't just a mood disorder, it's a whole body disorder, one that's deeply tied to our metabolism. And this idea is pushing us towards a whole new frontier, precision psychiatry, where treatments are actually tailored to the specific biological profile of a patient.
And a cardiology expert, Dr. Ching-Han Chen,
totally agrees, calling the result fascinating. It suggests that even under this one big umbrella of depression, there are different biological engines running, and each one is leading to a different physical destination.
And that leaves us with this really powerful final question. If the mind and the body's metabolism are this deeply intertwined, could the future of mental health treatment actually lie in therapies that target our physical bodies? This research suggests that's exactly where we might be heading. It's just a huge reminder that when we talk about mental health, we're really talking about our whole body health. Thanks so much for digging into this with me.